Mr. Engel.
Thank you, Mr. Chairman. Today marks a historic day one in which we finally begin reforming our broken healthcare system, a day in which we state unequivocally that allowing 46 million Americans to be uninsured is not only a national tragedy, but has also caused irreparable harm to hardworking families across our districts. Of the 46 million Americans, 80% of them are working people and their families. Today we state our commitment to ensuring that those Americans who want health insurance and need health care coverage are no longer priced out of a system that favors the haves over the have-nots. Today we recognize that beyond our own moral imperative to do right by those who struggle for basic health care services, that it is in the interest of our national economy to reform our health care system. Today is a day in which we support our businesses, which are buckling under the weight of crippling health care costs as well. Mr. Chairman, I want to commend your work, Mr. Engel and Chairman Pallone, for your leadership over the past 6 months in crafting the bill before us today. This bill will provide comprehensive, quality, and affordable health care for all Americans and controls health costs as well. While I am a proud co-sponsor of H.R. 676, Congressman Conya's bill to create a single-payer system, I strongly support the underlying bill here. However, while I am willing to compromise on single-payer, given the political realities, I must remain adamant that we must retain a strong and robust public health insurance option in this bill throughout markup and conference with the Senate. We must also ensure that the public option will work by creating a provider linkage between Medicare and the public option in the starting years. By doing so, we can provide true competition and choices for all Americans. While there are countless good measures to commend in the underlying legislation, I want to take a minute or so to talk about several of my priorities reflected in the health reform package. I am grateful to you, Mr. Chairman, for your inclusion of a version of my legislation, the Early Treatment for HIV Act, ETHA, in conjunction with the House's proposal to cover all low-income people under the Medicaid program up to 133% of the federal poverty level, is a significant step towards reducing the number of uninsured people with HIV in our country. As you know, because you were the original writer of this bill, ETHA addresses a cruel irony in the current Medicaid system, that under current Medicaid rules, people must become disabled by AIDS before they can receive access to Medicaid-provided care that could have prevented them from becoming ill in the first place. It makes no sense. And because New York remains the epicenter of the HIV/AIDS crisis, it is so important for my state that we do it. And again, Mr. Chairman, I want to commend you and Speaker Pelosi. You had both introduced ETHA many years ago and have been wonderful partners in ensuring that this policy is reflected. And your staff member, Tim Westmoreland, has just been terrific. I also want to thank you for supporting a provision that Mrs. Matsui and I have championed to define and authorize federally qualified behavioral health care centers. As we work to significantly expand the capacity of the public mental health system, it's critical that we update the basic set of services provided by these companies while establishing baseline reporting and quality data. So I want to thank you, Mr. Chairman, and for my colleagues who say this is not a perfect bill, I would say it goes a long way in doing the things that we know the American people want and need. And I thank you, and I yield back the balance of my time.
Thank you, Mr. Engel.